Hello, today I'm going to be talking about the chronic disease called hyperthyroidism. This occurs when the thyroid gland produces high levels of thyroid hormones, which speeds up one's metabolism and causes weight loss, heat flashes, shaky hands, and tachycardia. Some of the risk factors or causes that makes an individual more susceptible to the disease could be a family history of Graves' disease, a personal history of chronic illnesses, smoking, and a recent pregnancy. The course of the disease progresses through a sequence that accelerates the body's metabolism. The first phase that we see is called the subclinical phase, which is early on and is pretty mild. Lab results may typically show hormones that appear normal, but the only change is that the thyroid stimulating hormone is low. There are typically no symptoms in this phase, only mild anxiety, fatigue, or occasional heart palpitations. The next phase is called the overt phase. Here, lab panels begin to show increased hormone levels, the body's metabolism speeds up, and symptoms may include tachycardia, weight loss, despite increased appetite, heat intolerance, hand tremors, irritability, insomnia, and frequent bowel movements. This is typically the phase where people get treated, but if medical care is avoided, we further into the advanced decompensated phase, which occurs when hypermetabolism deteriorates muscle tissue and exhausts the cardiovascular system. This can cause atrial fibrillation or potential heart failure and severe osteoporosis. The last stage, which is also called the end stage, is rare and is called a thyroid storm. This this occurs when there is this is a sudden and life-threatening complication. Symptoms include high fever, severe rapid heartbeat, vomiting, confusion, and possible organ failure. Furthermore, a general prognosis of hyperthyroidism is with good and proper treatment, most people with hyperthyroidism live a normal and healthy life. It's rarely fatal, and fatality only occurs when it is left untreated. Some available resources for individuals suffering from hyperthyroidism would be, for one, support groups. So there's this foundation called the Graves' Disease and Thyroid Foundation, which offers virtual support via Zoom. And there's also the TED Community Organization, which offers one-on-one peer friendship and virtual storytelling workshops for people to tell their story. Um, to find clinics around someone's area, one can use the American Thyroid Association, which connects you directly to local vetted endocrinologists and thyroid surgeons. For medical adherence tools, one can use pharmacy systems like the pill package, which is designed to organize your dosages and manage your schedules required for hormone regulation. Now, for the part of the loved one, the person that I'm dedicating this assignment to is my mother. She is 55 years old and she lives a moderately active lifestyle, so she goes on walks occasionally but does not follow a consistent exercise routine. She generally eats a moderately healthy and balanced diet, although her meals are not always planned around managing hyperthyroidism. She has a strong social support system, as her twin sister, children, and husband are the main people she can rely on when she feels unwell and needs encouragement. In terms of medical adherence, she's very likely to follow her treatment plan consistently because she's highly organized and understands the importance of following doctor's orders. As she is a doctor herself, she's familiar with taking medications as prescribed, attending appointments, and completing any necessary blood work. Additionally, she has a strong background in the importance of treating hyperthyroidism properly, so she knows the science behind it, which makes her more susceptible to following her treatment plan. Ways I would support my mother going through hyperthyroidism, is one, to check in on her regularly, ask her how she's feeling, pay attention to her symptoms, and encourage her to contact her provider if any symptoms worsen. I could also help with her appointments and offer to drive her. Um, I could support her medication schedule and check in on whether she's taking her prescriptions, which, since she's highly organized, I'd probably not do it as often, but yeah. I would also encourage her to go to increase her physical activity a little bit by going on walks with her and encouraging her to implement balanced meals in current to further implement balanced meals in her diet. The last two would be emotional support. So obviously listening to her and providing her reassurance that she's not alone, and also offering fans around and putting more fans around the house, given that heat um intolerance is more common in hyperthyroidism, and it's very beneficial for people that suffer from heat flashes. And the resources that I have used in this presentation are all provided in the text box below, but I used the Mayo Clinic, Cleveland Clinic, and a peer-reviewed article through the National Institute of Health PubMed Central Database. Thank you very much.